Hello, my name is Lakeisha Sire. Today I'm going to be demonstrating how to do a head-to-toe assessment. My associate or my volunteer today is Cassandra Kimple, and I'm just going to jump right into it. For starters, I'm probably going to be assessing her general health assessment, asking questions about why she's in today, if there's any concerns. Does she have any current problems, any existing problems with any portion of her body? Does she have any pain or discomfort? Does she have any allergies? And also getting a current medication list if necessary, or if she's taking anything that's prescribed or over the counter. I'm going to be assessing her general appearance, if there's anything off with her posture, which clearly there's none. Later on, I'm going to assess her gait, but this can also be done while the patient is walking towards the examination room. I'm also checking her face for any affect. Does she have a flat affect, or does she have emotion? She can express emotions through her facial features. I'm also going to be checking her entire body for any deformities, if everything's symmetrical, and any signs of distress as well, and balance. I would also check that if she's sitting and leaning over, or if she's walking and having any balance issues. For her skin, I'm going to be assessing color, temperature, any deformities, any bruises, any bumps, any lumps, hair distribution as well. And I'll check her nails for any clubbing of the fingernails, for capillary refills, if she has any ingrown, any issues that can arise with nails. So first I'm going to start from the head going down. I want to assess mental status, so I'm going to ask the patient to state to me name, date of birth, and location if she knows where she is, and time of day. So, do you know where you are today?
Yes, Bucks County Community College.
Can you state your name for me?
Cassandra Kimple.
What's your date of birth?
10/20/88.
And do you know what time of year we are in?
November.
November. Do you know the season?
Winter.
Okay. Starting with the head, I'm gonna palpate her scalp for any bumps, any lumps, see if there's any changes with her scalp, like does she have psoriasis, is her scalp dry, is it moisturized, that sort of thing. So I'll go ahead and palpate her scalp. Also checking for hair distribution, if she has hair evenly over her scalp, is she balding in any areas. I also will ask the patient, does she notice any change in her hair, falling out, anything? No. If her hair is brittle, I'll also check to see if there's any lice or anything in her hair, which there's none. I'm going to be checking for symmetry of the ears, of the eyes, of the nose, seeing if the face is symmetrical. I'm also going to ask the patient to smile for me and wrinkle your brow, puff your cheeks out, and okay, then I'm going to palpate her face, palpate the sinuses, ask if there's any pain or discomfort as I do this. Do you notice any pain or discomfort? No? Frontal. I'm also going to palpate the temporal lobes. If there's any pain, notice when I'm doing this, it's an emergency. I'm also going to palpate the temporal mandibular joint. Ask the patient, can you open your mouth for me? Okay, close. Is there any pain when I do this?
No.
Okay, and it's symmetry. I could feel it on both sides as she opened and closed her mouth. I'm going to check mucous membrane. So I'm going to ask the patient to open her mouth can use a pen light for this. Mucous membranes moist, no abnormal appearances. Her lips are moist as well. At this time I can ask her to stick her tongue out and move it from side to side. Okay. Also, I would check with a tongue depressor her uvula rays, and that helps determine neurological function. We won't be doing that today. Now I'm gonna check for Perla. I'm gonna ask her to follow the pen light with her eyes. Well, Perla will check pupil reflexes. So look straight ahead at me. Okay. Both pupil constrict when the light was shone in either eye. Now I'm gonna have you look at the pen light and follow it with your eyes. Patient was able to follow pen light with her eyes, so the eyes, Perla was checked, and accommodation and conversion. Now I'm gonna ask the patient to see if we both can identify my finger at the same time. We're gonna close an eye and see if we, for peripheral vision. So,
See it.
see it? Okay, good. This one?
See it.
Okay. Now I'm gonna work my way down to the neck area. I'm gonna palpate. I'm also gonna palpate for her carotid. And you wanna do this one at a time so you're not occluding both carotid at the same time. I'm gonna have her swallow. Okay. Then I'm gonna check range of motion for her neck. Can you, one side, the other side? Okay. Did you notice any pain or discomfort when doing that? No pain or discomfort noted. Range of motion is symmetrical. Then I'm gonna check the chest area. I'm gonna first look to see if there's any, if she's breathing normally, if there's any distress with breathing, and she doesn't have any. I'm gonna ask if she noticed any shortness of breath with movements or exercise or walking upstairs. Have you ever had any no? I'm also gonna ask if she's noticed any issues with breathing, have any recent colds, coughs, noticed any wheezing or changes with their breathing. I'm gonna palpate. And then I'm gonna listen anteriorly with my stethoscope. In a perfect setting, I would be doing this on bare skin. I already cleaned my stethoscope with alcohol swab and warm it to touch. Take a deep breath. adventitious sounds heard. I'm also gonna listen to her heart. I wanna hear, use the bell to listen to the pulmonary aortic valve as well as the tricuspid and mitral valve, and I'll also listen to her apex and feel for the maximum point of maximum impulse. I'm gonna use the bell. Again, this would be done on bare skin. To feel the point of maximum impulse, I would have the patient lay on her side. And I would place my hand at the fifth intercostal space, mid-clavicular. Have the patient lean forward a little bit. That pushes the heart closer to the chest wall. And then I would be able to feel the pulse. Okay. At this time, while assessing the heart, I could also ask the patient if she's noticed any changes when with palpitation. Notice any palpitations? Have had any chest pains? Have you ever noticed, like when you're standing, you feel dizzy from a seated position? And any history of heart disease in your family? Any current problems with your heart now? Okay, now I'm gonna be checking the upper extremity. So again, we'll be observing for color, for texture, for any discoloration, any lumps or bumps or bruises with the skin. Note if there's any shunts, if she's a diabetic, a dialysis patient. Also, I'm gonna check for strength, look for symmetry, and so I'll first palpate after inspection. I also wanna look at her fingers, check for capillary refill, check temperature of the skin. I wanna feel for the brachial pulse. And I wanna be able to palpate them bilaterally. Also gonna check the radial pulses. Check for them bilaterally. Okay. We're checking to see if they're if it's bounding or absent or really hard to palpate. We're also looking for any edema in the arms, any deformities. I'm also gonna check for strength. So I'm gonna ask her to squeeze my hands as much as you can. Good. I'm gonna have you hold your hands out like this. and try to prevent me from pushing down, okay? And the same, prevent me from pushing up, okay? I'm gonna have you do this, prevent me from pulling out, okay? Prevent me from pushing them in. Okay, that's good. Also I wanna check range of motion, so I'll have her of the shoulders as well, behind your ears, your head, sorry, your back. Do you notice any pain or discomfort?
No.
Okay. Moving down, next I'm gonna check her abdomen. First, we wanna inspect for any bulging, for the shape of the abdomen. Then we're gonna, when we're checking the abdomen, it's reversed in how we go about doing it. So we were gonna auscultate before we palpate. At this time, I'll have her lay. And I'm looking at the abdomen to see if there's any movements with peristalsis. Sometimes it's noticeable when the person recently had a meal. You can see peristalsis. She's breathing, there's no distress with her breathing in her abdomen, so no use of accessory muscles. Okay, color is good, temperature is good. And then I'm gonna auscultate. I'm gonna use the diaphragm, starting in the right lower quadrant, and I'm gonna be listening for vowel sounds between 5 and 30 in 1 minute. I'm gonna be using the bell of my stethoscope to listen for bruit in the aorta. None was detected, which is what we want to hear. Nothing. Now I can palpate. Before, you'd want to make sure that the resident or patient use the restroom before this step, because you don't want to cause them to stress incontinence. So I'll do light palpation first and then deep palpation. At this time, I'll ask the patient to tell me if there's any discomfort when palpating. Then I'll go deep. Notice any discomfort? No discomfort noted at this time. I'm gonna have the patient sit up and note if there's any bulging at the umbilicus to detect for any hernia. Can you sit up? No bulging, no hernia detected. So at this time, I'm gonna assess the lower extremities, and the same thing as follows, where I'll be checking the skin. technical difficulties. Oh, just
Okay.
motion. Well, it's cold outside, so we're not appropriately dressed, but her skin would be exposed. We'll be checking the skin for any discoloration, any bruising, any lumps, any bumps, any deformities of the joints or her extremities. I'm gonna ask, have you noticed any tingling or numbness in your legs? No. Any burning of any sort? Do you have difficulty walking? No. So then we'll palpate. Palpate. Any pain when I touch? Also, I wanna check for range of motion and strengthen her lower extremities. Can you push up? Prevent me from push. Okay, prevent me from pulling them out. Good. Also, I'll check capillary refill in her toes, just make sure circulation is good and there's no deformities or abnormalities with her toes, any discoloration. Temperature is good, check for temperature. Also, try to palpate the popliteal pulse, which sometimes can be challenging. Also want to palpate, and you want to do that on bilateral legs, extremities. Also want to palpate the posterior tibial pulse. And also we would palpate the posterior, what's this? The pedal pulse, sorry. Also palpate the pedal pulse bilaterally. At this time, I'm gonna ask her to stand and walk a little bit to see gait and symmetry of her legs walking. Also, I would have her bend forward just to check alignment of her spine. Okay. I'm gonna have her also run her heel against her shin. And also I can check for the Babinski reflex. This, I would use something sharp to run along the bottom of her foot to have her toes curl upwards. Let's try that. I'll just do one side. Wait. So her toes should curl up and not fan out, and it did that. If I'm gonna ask her if she doesn't mind turning that way, so I could do the posterior portion of her assessment. So same thing, I'll look for symmetry, check the skin for color, any abnormalities with skin changes, whether eczema, note of any mole, any dryness, any patches, any rashes or anything. And then I'll palpate. Is there any tenderness? Okay. I'm also gonna check for lung expansion at this time. Okay. Then I'm gonna listen to her lung sounds posteriorly. And again, this would have been done on bare skin. Deep breath. Lungs are clear, no adventitious sounds heard, such as wheezing, any rhonchi, any rales, any what do you call that? Crackles. So now I'm gonna check her kidneys. I'm gonna palpate the kidneys at the costal vertebral angle, and this should be painless. So I'll ask her to tell me if she detect any pain while I do this. No. No pain detected.
I think the context is.
And that will complete my head to toe assessment. Thank you.